Your CBT questions answered now. It's the NMC CBT with Nurse Mary and your host, Christina. Revising for your NMC CBT. Is your NMC CBT exam date approaching fast? Then your revision is incomplete without the NMC CBT Complete video course, written by a senior UK registered clinical nurse educator and an experienced NMC CBT tutor. The NMC CBT Complete video course includes easy to follow CBT courses focusing on the exact areas you need in order to pass your NMC CBT in one attempt. It also includes tips and tricks for the CBT exam, as well as tried and tested CBT materials and individual progress reports. Plus, our CBT nurses also receive 30-day access to a complete NMC CBT mock examination. Learn more at www.cbtnurses.com. The first module of the course is free.
Hello and welcome back to episode 13 of NMC CBT discussions with Nurse Mary and me, Christina. Hi Mary, how are you today?
I'm good, thank you. How are you?
Yes, I am very well, thank you. Let's get started with episode 13. I think we're looking at some Part B questions today. All right then, episode 13. So some Part B questions today. Question 1, what is a whistleblowing policy? Choose the correct answer. Is it A, a major incident policy, B, a government-led policy that advises trust on care, C, a policy that helps employers manage staff, or D, a policy that guides staff on raising concerns about safety and practice?
So the answer to this question is D, a policy that guides staff on raising concerns about safety and practice. That's why it's called the sort of whistleblowing policy, so that everybody has the opportunity to raise their concerns without feeling like their position in work is compromised.
Question 2. A patient is experiencing difficulty with swallowing. What steps should you take in order to preserve safety? A, refer them to a dietitian. B, refer them to a speech and language therapist. C, give them a meal replacement drink. Or D, insert a nasogastric tube.
Okay, so the answer to this question is to refer them to a speech and language therapist. They will assess their swallowing difficulties and create a plan of care for the texture and thickness of the food and drink which they have to minimise the risk of them choking.
Question 3. A This Is Me document is implemented to aid in care for which patient group? A, patients undergoing routine surgery. B, children. C, patients with dementia. D, patients with diabetes.
Okay, so the answer to this question is C, patients with dementia. So the This Is Me document is a really nice document to basically ensure that we're doing patient-centred care, so that we know the dislikes and likes of somebody with dementia when they might not be able to communicate that with us themselves anymore. It's also really helpful in understanding their baseline, for example, their level of confusion, what they can and can't do, because if somebody with dementia has an infection, if you don't know their baseline, then you're not going to pick up on their conscious level on the A to E assessment.
Question 4. A patient has oxycodone prescribed. With opiate drugs, what should you also check is prescribed? A, antibiotics. B, non-steroidal anti-inflammatory drugs. C, antiemetics. Or D, naloxone.
Okay, so the answer to this question is D, naloxone. Naloxone reverses the effects of opiates. So in case of an overdose, it should always be prescribed alongside opiate drugs. Also, you might think that antiemetics is the answer, as opiates can make you sick, but they don't need to be prescribed with opiate drugs, although it would be handy if they were.
Question 5. What medication is given to someone to prevent the long-term disabling effects of an acute ischemic stroke? Siloxane, thrombolysis, antibiotics, or paracetamol?
So the answer to this is Clexane. Clexane is a blood thinning medication, so it would reduce the likelihood of a clot causing a stroke.
Great, thank you so much. And I think that is all for today. Thank you so much again, Mary, for being here and answering all our NMC CBT questions. And don't forget to like and subscribe so that you never miss an episode. And if you have any questions that you would like Mary to answer, any CBT questions that you would like Mary to answer, please get in touch or comment below. And we will see you next time.